plenary session this evening. Let me very quickly, because this will be on human capital development, let me welcome our moderator, senior editor, anchor, and special correspondent, Arise News London. Please welcome Mr. Charles Aniagolu. I'd like to welcome you. Please up here. Thank you. And as part of our panel is the founder of the Wellbeing Foundation Africa. Please welcome Her Excellency Mrs. Toyin Saraki. The country director of World Bank, Mr. Rashid Benethad, is also joining us. I'd like to welcome you. The country director of Bill and Melinda Gates Foundation, Dr. Pauline Basinga, is also joining us. The CEO of Sterling Bank PLC, Mr. Abubakar Suleiman. And so, Your Excellency, distinguished ladies and gentlemen, there you have your panel, and we have the moderator set. Charles, you can take it away now.
That's brilliant. Thank you very much indeed. And I just want to say a quick hello and welcome to this NESG session on human development, officially titled Poverty to Prosperity, Making Governance and Institutions Work. And that is, of course, easier said than done, given that here we are. Nigeria is, of course, a symbol and a signal to the rest of Africa. But whether the country will ever properly benefit from its abundant human and natural resources is a question that's more relevant now than ever as the 2019 presidential elections approach and issues of good governance and economic development look set to top the campaign agenda. Can this country really turn its huge potential into tangible wealth for ordinary people? Well, today, that's one of the big questions our distinguished panelists, as well as our select audience, will be grappling with. On the panel, of course, as well as the audience, we have people with political leanings, business representatives, global institutions directors, activists, and academics from across Nigeria, Africa, and the world, all of them experts in their own right, taking part in this NESG Human Development Forum. I'm going to speak briefly, just for 5 minutes, to set the parameters of the discussion, and then I shall invite the members of the panelists to come and speak for 5 minutes each to set out their stall, as it were. According to Joseph Stiglitz, and I'm sure you're very familiar with him, according to Joseph Stiglitz, a former chief economist in the World Bank and professor of economics at Columbia University, on average, resource-rich countries have done even more poorly than countries without resources. So why is that? Well, hopefully we'll be getting to grips with that nettlesome issue in the course of today's session. But the fact is that there are greater inequalities in resource-rich countries than elsewhere, as we can see in places like Nigeria, considered to be one of the most unequal countries in the world, and too often there is also endemic corruption, something I'm sure we're all familiar with regard to Nigeria and many other countries around the world and in Africa. At least $400 billion of oil revenue are thought to have been stolen or misspent since independence in 1960, according to estimates. That is 12 times this country's national budget. Meanwhile, 90% of people live on less than $2 a day. High poverty persists. Nigeria ranks as one of the countries with the highest number of maternal, infant, and child mortality rates, with one of the highest numbers of malnourished children and the highest number of out-of-school youth in the world, according to UNICEF. And to make matters worse, of those who do go to school, over 70% of graduates are thought to remain unemployable because though they have the paper qualifications, they lack the right analytical and work skills needed to attract a decent job, thanks to the very low standard of education available to them at the universities and polytechnics. So, as you can see, the scramble for Nigeria's resources, notably oil, has often caused problems rather than created prosperity. Meanwhile, Nigeria, of course, Africa's biggest oil producer, does not refine its own oil and many of its other raw materials. Rather, the value is added elsewhere for the benefit of others, and there's very little provision in terms of employment and improvement to the standard of living. So why has Nigeria failed to make the most of its natural resources and to turn it into benefits for the masses? Who is to blame and whose responsibility is it to put things right? Could there be a different story to the one this country has known since independence? Well, let's begin the debate and the discussion. First, straight away to our distinguished panelists, and it is my great honor and pleasure to introduce them to you as follows. I'd like to introduce Mrs. Toyin Bukola Saraki, who is, of course, the wife of the President of the Senate of Nigeria, and also in her own right, the President and founder of Wellbeing Foundation Africa. Mrs. Saraki. And at the far end, Mr. Rashid Ben Messaoud, who is the country director for the World Bank here in Nigeria. And next to him, Dr. Paula Basinga, Country Director, Nigeria, for the Bill and Melinda Gates Foundation. And last but certainly not least, Abubakar Suleiman, who is the CEO of Sterling Bank PLC. Now, the focus for the session is in these areas. We want to talk about welfare services, the quality of education, basic health care services. The Minister of Health was supposed to be here. Unfortunately, he has not arrived. We want to talk about poverty reduction priorities, education access and provision, and very importantly, narrowing income gaps. And what I'll do, because we're already out of time and we don't want to keep you waiting too long, we're going to give each of the panelists 5 minutes to come up here and set their stall and give us a sense of their take on the focus of this discussion, what they do in their organizations, and how that might make a difference here in Nigeria to improve things. So I'm very delighted to first of all invite Mrs. Toyin Bukola Saraki.
Thank you very much, distinguished ladies and gentlemen. It's my pleasure to be present at this 24th Nigerian Economic Summit. and it has been the foremost annual economic forum for policymakers and captains of industry from the private and public sectors. This is actually the first time I've come myself, first time I've been invited. And I think I was the last to be invited to avoid a manel, but I was very, very happy to provide balance to this panel today. The economic impact of this summit cannot be overemphasized, and I commend the organizers and stakeholders here present for your continued contributions to the development of Nigeria's economy. As the founder president of the Wellbeing Foundation Africa, I'd like to review progress within the health sector and the economic impact that I have tried to make within this country. Throughout the years, I've led a team of enthusiastic young professionals in developing programs that have made great impact, in my opinion, in reducing mortality in the country. According to the data available, the global rate of maternal mortality has dropped by about 44% between 1990 and 2015, but the prevalent mortality rate is still unacceptable in Nigeria, as 1 in 13 women will die during pregnancy and childbirth. The mortality rates for newborns, as stated in a recent UNICEF report, stands here at 7,000 deaths per day. That is about 4 children per minute, while the mortality rate for children under 5 years is about 15,000 children daily. In order to mitigate the effect of maternal and child mortality and its effect upon society, the Wellbeing Foundation Africa developed its own Mamuh Care antenatal and postnatal education classes, which provide information and skills needed by pregnant women for their antenatal, intrapartum, and postnatal health and well-being. We run these classes using trained midwives in 4 states of Nigeria and the Federal Capital Territory, that is Kwara State, Osun State, Lagos State, and Abuja, while we run a different nutritional program also in Lagos State and Kaduna States of Nigeria. Since we started these programs 18 months ago, we have reached over 200,000 women through the years, and it pleases me to say that we haven't lost a single Mamuh Care mother to death. We continue in the postnatal period, and we also try to provide financial assistance from the mothers, not from point-of-care expenses, which are both unreasonable and unaffordable, but by encouraging our mothers to save. So we partnered with Access Bank to start a birth preparedness savings scheme, where the mothers can open an account with a minimum balance, but get double the interest rate for their birth preparedness, which gives them choices. Following the success of these Mamuh Care antenatal and postnatal classes, we partnered with the Liverpool School of Tropical Medicine and Hygiene to initiate the Emergency Obstetrics and Newborn Care Program in Kwara State with financial support from the Johnson & Johnson Global Health Group. Through this program, we initially trained 600 master trainers in 9 local government areas, who also went on to train a further 62,800 health workers and set up 10 skills laboratories in 10 selected core training medical facilities. Last month, we have now scaled up this program to all 16 local government areas in Kwara State to ensure that all expectant mothers in the state have access to a skilled medical worker who is trained in handling emergencies and complications. We hope that with further support from stakeholders, we will be able to take this program from post-service training in medical facilities to pre-service training in medical schools and nursing schools across the country. We need to do this to reduce the current narrative and the current results on maternal and child health in our country. If I'm to share just one from the field example, the last time I went on an assessment of this program, a doctor who had just received his training told me, and he was 10 years post-qualification, he told me it was the first time that he had learned how to do a proper episiotomy, which is shocking considering he'd been in practice for 10 years already. Nutrition is as important in promoting the growth and development of every Nigerian child, and breastfeeding should be the major component of nutrition in the first 1,000 days of life. Yet, here in Nigeria, we found that more than 800,000 children under the age of 5 die each year, and the majority of new mothers do not practice breastfeeding. Across the country, only 33% of children are breastfed within the first hour of birth, and only 17% are exclusively breastfed for the first 6 months of life. Furthermore, poor infant and young child feeding practices contributes to the prevalence of 37% of stunting in the country and 18% of wasting, with underweight children being at 29%. To this end, we partnered with the Family Health International 360, McCann Global Health, and fortunately the Bill and Melinda Gates Foundation to run and implement the Alive and Thrive program in Nigeria. We are concentrating at the moment in Lagos and Kaduna states at 790 health facilities throughout the 2 states, where again we are using midwives and again we are using anatomical models to train the health workers in the health facilities to ensure that a mother can breastfeed her child within the first hour of birth. In February this year, the Wellbeing Foundation Africa developed its strategy for water, sanitation, and hygiene. This decision was encouraged by the World Bank Water Report, which showed the critical state of WASH within the country. In May, we launched our Global WASH campaign in partnership with Global Water 2020, and our advocacy on WASH took us to Washington, D.C., where we met with members of the United States Congress to ensure that funding for WASH in Africa would continue. In September, we partnered with Unilever's Lifebuoy and Sight Savers to take our WASH campaign to 2 million children in schools across Nigeria and local communities across the country in the next 12 months. Hand washing with soap is simple, but hand washing with soap prevents diarrhea and other related diseases within communities. It also prevents maternal sepsis infection within our medical facilities. The economics of scale in promoting the health and well-being of mothers and their babies cannot be overlooked. And some of the reasons that are inherently a challenge for us in Nigeria include the inverted pyramid we are currently organizing, where people are going to tertiary specialist hospitals with a sore throat, but presenting at primary care with acute appendicitis. In both cases, the facilities that they are presenting themselves at are ill-equipped to look after them. To stop the deaths, we have decided to mount a social enterprise to invest in primary health with our partners, Dye Global and IntraHealth, to actually bring affordable quality care to every Nigerian in their community where it is needed. This is going to need a huge investment, and it's going to need the buy-in from private sector players, from government institutions, and also from our everyday citizen on the street. The average Nigerian accesses healthcare only as an emergency, myself included. We need to begin to make that investment in actually keeping ourselves well, in having everybody insured by one form of insurance or another, so that we can actually achieve what we call universal health. In 2015, global leaders met and they agreed on a set of 17 ambitious goals. But as Dr. Tedros, the DG of the WHO, said at the World Health Summit in Berlin last week, if we do not take urgent action in Nigeria, we will be starting off a domino effect that the world can ill afford. And it's for that reason that the Wellbeing Foundation has committed itself to ensuring health for every Nigerian and health for all. Thank you very much.
Thank you very much indeed, Mrs. Toyin Bukola Saraki there, setting out the issues in healthcare in Nigeria and the things that need to be done to move things forward. I've just been suitably informed that it's probably best for everybody to sit where they are and talk from where they are. So sorry I had to put you through that, but I think there are microphones there, so it makes it reasonably convenient for you to sit where you are and actually talk to us from there. And the next person who very critical in this discussion and looking forward to solutions is, of course, Mr. Rashid Ben Masoud, who is the country director for the World Bank, and would like to hear what he's got to say over the next 5 minutes.
Thank you very much to NESG for inviting us to this 24th summit. I'm very much delighted to be here representing the World Bank Group. And I think I should begin by talking about poverty first before talking about human capital. And I think here I would like to take a broader view about Africa. I think the progress in the fight against poverty in Africa, and also here in Nigeria, has been very slow. And the reason is that the population growth is outpacing the economic growth, and also all the efforts that have been accomplished.
Sorry, do you mind speaking more directly?
Okay.
Right, and that way it's a little bit easier to hear you.
Okay, so it's, I just was saying that really the population growth is outpacing the economic growth, and it has really wiped out all the poverty reduction efforts. And in absolute number of people, the population living below poverty line is increasing. And in Nigeria, it's 1/5 of the population of the sub-Saharan Africa, and it's the third populous countries in the world if it continues at this pace of growth. But it accounts for 1/3 of the poor people in Africa. So in terms of progress towards reducing poverty in Africa, it has to happen in Nigeria. So the critical importance of Nigeria for the global reduction fight against poverty. As you know, the World Bank has launched the Human Capital Index back in Bali. And this Human Capital Index is basically a measure of the productivity of the individuals. It looks at the future generation, and it has really three components. One is the component about survival, the second component around schooling, and the third around health. So on survival, it's basically a measure of it answers the question around will a child born today will survive the school age? That's the first question. The second question is how much of school will he or she complete and how much will he or she learn? And the third question is will he or she leave school in good health, ready for further learning and for work? So the fact of the matter is that Nigeria did not score well. It scored as 152 out of 157 countries. So that means we need to really call for action. So I think it is very clear that countries that have experienced really sustained economic growth are those really countries that have really invested in human capital. And there are a number of things that needs to be done, both on the education front, on the health front, and in the quality of learning and in the productivities of the young people and young girls. So I think when we think about the human capital, first is about stunting, stunting of the children. Stunting is really a huge challenge in Nigeria, and a lot of the children, more than 44% of the children are stunted. And this is really a number of things that can be done relatively easy to bring the health to the child. The second is the high fertility rate, and it is really an explanation of the poor outcome. So I think high fertility rate is also a problem, and it is in fact a problem because in Nigeria it's around 6 to 7 child that a mother can have, and really a mother who has a child every year is not going to be able to productively contribute to the economic opportunities and the well-being of its children. So I think it's really important that we address this problem of fertility, and it's across the whole sub-Saharan Africa region, the problem of both stunting and high fertility rate. I think we also need to think about what the young Nigeria needs. And I think when we think about Nigeria's needs, is we need to go back to its population. The population of Nigeria is really a young population. It needs growth, it needs jobs, and it needs different type of job. It is jobs that allows them to be connected to the rest of the world. So it's a youth population, and the average age of Nigerian is between 17 to 22 years old. So therefore, they need to have an economic growth that provide them with job opportunities which are really linked to, that are created by the digital economy, by the private sector. So I think if Nigeria, we need to leapfrog into the 21st century, I think we need to invest more on its people, but also bring in technology and the digital economy at the center of resolving the problem of Nigeria. I think the education system has to be different, and it is a education system that really brings in the technology. There are a number of initiatives that can be done to bring technology to the classroom, to standardize the curriculum, to bring the really good scripts in terms of the learning materials and standardizing them, and to make sure that they have access to science, technology, mathematics, and so on. So digital economy is really going to be one way of leapfrogging to the 21st century. And I think we need to finally, when I think about the digital economy, it's all about the infrastructure, it's about the digital platform. And I just want to share with you a small experience that we did about 5-6 weeks ago, where we had the training done in Kaduna for young boys and girls, for 900 to 1,000 boys and girls, the age of 18 to 25. And we trained them to access to the job market over the internet over 5 days. And guess what? They were able to, after the training, when it was completed, some of them went back and they were able to get the first income through the digital platform. Some of them reported that they started earning already $100 to $200 per contracts, and it's very good. And we need to scale up those initiatives. And finally, I think it's really important to think about tackling the conflict and fragility. That is really an important part of the human capital. It's doable. And the good thing is that all of this, what I'm saying, Nigeria has had a number of success stories, and we should build on the success story. There are success stories on the social protection policy and the social protection program currently by the government, on its attempt to eradication of polio, its attempt to combat malaria, and innovating financing on the healthcare system, and a number of actions taken on improving the teachers. So all of these are important. And finally, it's very refreshing to know that the government of Nigeria has taken the human capital investment at its heart. It's a pillar of the economic growth, recovery and growth plan. And the government has established a working group under the National Economic Council, which is trying to come up with a specific response to invest in people. So there was a call for actions launched by His Excellency the Vice President, and I'm happy to share with you what was the call of the actions after the introductory remark. Thank you.
Thank you very much indeed. And that's, of course, Mr. Rashid Ben Masoud, who is the country director of the World Bank here in Nigeria. The World Bank, of course, investing tremendous amounts of money, not just in Nigeria, but across Africa, but also responsible for some of the rather depressing statistics we get to hear about this country. So it's a sort of a double-edged sword there. Those statistics very important in understanding what the problems are and how to solve them going forward. Now, just moving further down the line, we've got Dr. Paula Basinga, who is the country director of the Bill and Melinda Gates Foundation. And of course, they work with both the government and the private sector in Nigeria here, for those who may not be familiar, as well as civil society, to help people lift themselves out of poverty, particularly children, mothers, lots of people in the agricultural sector, and so on. So over to you, Dr. Basinga.
Thank you very much, moderator. I'm not sure what I will say, going after Her Excellency, who has been a great advocate for investing in our people, and your great introduction, and also after Rashid, who just went through all the definition of investing in human capital and going through all the numbers. I think I will just, put this away because they've just, took all my talking point, and I'm now stuck. I've tried just to share some ideas in terms of like the work that the Gates Foundation does in Nigeria, and then also some advice, kind of like going, from the federal level down to the state level, kind of like what need to be done. So we've been in Nigeria for the past 10 years, and we partner with the government of Nigeria and several partners. And the first entry point was really to kind of like bring our broader work on global polio eradication in Nigeria, as Nigeria was among the last 3 countries, among with Pakistan, Afghanistan, to eradicate polio. And when you look for the past 15 years, the only one indicator that is going down is the number of cases of polio. The Nigerian government has done amazingly well. Through several governments, it has been clear that the commitment to eradicate polio has been there. Even last week, we attended the Presidential Polio Task Force meeting, where the Federal Ministry of Health and NPHCDA presented the progress so far. It has been now more than 2 years without any case of wild polio, even though we are struggling now with an outbreak of derived polioviruses, but the government is really doing its best to really tackle that. But when you, apart from polio, when you look at the other indicators, routine immunization, maternal health, child health, malaria, tuberculosis, all the other indicators are flat. And this is really explaining the increase of child mortality, maternal mortality, etc. And there is a clear commitment for the government of Nigeria to really invest in human capital. As Rashid said, that there is now a steering committee, there's a national engagement to really revitalize investing in people, and then also a very clear commitment. And then also when last month, there was a report that the Gates Foundation published in New York during the Goalkeeper Report, which showed that in 2050, 90% of people living in extreme poverty will be living in sub-Saharan Africa, and 40% of them in only 2 countries in Africa, DRC and Nigeria. And the bulk of those people will be in Nigeria. And in specific states that are really struggling to, raise, some of those key indicators. Now, what can we do in terms of really making sure that we put in place some very specific people-centered reforms? Yesterday I attended the opening session, and there was a very, very, interesting, keynote speak by Professor Lewis, who showed something very instrumental in terms of there is a need to really look at some specific, reforms that are driven by specific political leaders that are really development-oriented, that really think about what can we do. If you look at specific states, for example, one thing which is making that we are not able to decrease drastically maternal mortality or child mortality or improve education outcomes is that it will be almost impossible to wait that the country will rise all at the same time. The second session also, when the Excellency Vice President was talking about how they were able to control corruption in Lagos State, for example, he went into really describing some very drastic reforms that happened, many years ago in Lagos State. And when you go back, you look at how, different governors were able to kind of like tag team across several governments and really try to implement those drastic reforms. I'll just end by proposing probably 3 points. So if we look at after the election next year, is there a way that some specific, state can really put investing in people as a top priority to really change the indicators going forward? One of them will be probably to, first of all, prioritize, and that prioritization will come with some cost. It means that you are going to kind of like, put away the release of funds for some other infrastructure project and really release actual funds for, education and health. Because there are many states that have put money into their budget, but on average, at the end of the year, when you look at the release, it's between 2 and 10% money that has been released actually, to invest in people. But then the bulk of the other investment is really on paying salary. The salary wage is huge. I was part of another session yesterday when a governor said that on average, they pay 50 billion a year on salary, but the governor did not think that they are getting 50 billion out of, in terms of like, a return on investment in terms of that. So if you really think about reforming your, like human resource, and then really to try to think about how much money is going to pay salary, what are we getting out of those salary, but those require significant reform that are not politically easy to implement, but it only at the cost of implementing those very drastic reforms, like taking sector by sector, that will be able to unleash that. That is be possible if you really look at the data, trying to really go in details at the state level to understand how many facilities do I have, how many staff are there, are they trained, do they show up at work, are they equipment at those facilities, are they medicine, etc. Who's bringing those medicine? So that we'll make sure that when we talk about investing in people, those people who are at the bottom of the pyramid, who are Nigerians struggling every day to make their living, they are really the engine of this economy, but they are just one disease away from going back to extreme poverty, because when they fell sick, the catastrophic expenditure that they will incur because of the fact that the public services is not there to cater for them, it's really instrumental. So I think we all need to, think critically and think about, all the great plans that we have. How are we going to really move forward and actually do effective implementation of our plan to make sure that, state after state, sector after sector will be able to increase the coverage of indicators, because there are a lot of pockets of, evidence and great projects, but when they add up, it doesn't really increase coverage of key intervention. This is why we continue to see mortality increasing, and it will be like this if really state by state there is not a drastic change. But just by finishing, we'll say that the Gate Foundation is truly committed to continue partnering with the Nigerian government, the private sector, civil society. We have many of our grantees and partners here, and we were here. Nigeria is it's our biggest country office in Africa, and we are truly honored to be here. For these people that are the Nigerian people, we'll be here for the long term, and we are really thinking about being here and partnering with you all. Thank you very much for having us.
Thank you very much indeed, Dr. Paula Basinga, who is, of course, the country director for the Bill and Melinda Gates Foundation here in Nigeria. It'll be interesting to talk to you a bit later as the discussions begin to get more sort of into what you're actually doing in Nigeria and how much difference you're making, and some very interesting points you made there. But of course, if you want to move forward beyond aid and help and that sort of thing. You want to talk to an investment bank. You want to go up there and get access to finances and be able to develop your business, create employment, and so on. And certainly one bank that's preeminent in that direction is Sterling Bank PLC of Nigeria, and the CEO is here with us, Abubakar Suleiman.
Good evening, distinguished ladies, gentlemen. I will stand on existing protocol. As is the unspoken policy, the private sector comes last after everybody else. Unfortunately, I think that is exactly what the problem lies. There is clarity as to what the issues are. I think we all agree in this room that there is a crisis in education and there is a crisis in the health sector. There is something else that I also think we should be able to agree on. If we take the entire resources of the federal government and we allocate it to education, it will be insufficient to solve the problem. Same thing applies to health. And so the question is, are we here to tell the government what to do with its resources? Or are we offering a new approach to solving the problem? My sense is that if we don't have a different answer, if we don't have a different way of approaching this problem, I think this is going to be a wasted effort. To give you a sense as to why I'm convinced this is the way to go, the average emerging market, the federal or the government controls about 25% of the GDP. In more advanced economies, it's about 30% and above. Nigeria is struggling at 15%. Not only are we struggling at 15%, we have a massive backlog of investment in infrastructure that we need to attend to. So the point is, how much can the government possibly do? I'm not here to tell the government what it needs to do. We all agree that they can be more efficient and that they can focus on the policy issues. I'm here to make a major observation, which is that if you want to solve a problem of this nature, 15% of the GDP is not enough resources for it. I also want to make a couple of comments or contributions as to what we can do. And finally, I will tell a simple story of what we have done. In terms of what needs to happen, I like to look at it, and I look at both the health and the education space as critical to what we're trying to do, but I also feel that the issues are very similar. I take it from the demand side, which is how do we make it possible for our people to be able to afford the basic level of education that they need, especially the education they need to be able to be productively engaged and to be able to have basic health services for a start. The first comment is that we do not have the capacity to pay per capita what is paid per capita in the rest of the world. It's just not going to happen. One of the statistics that I found quite shocking was that the average high school student in the US is trained at the cost of about $11,000 per annum. That gives you a sense of what it takes if we are trying to replicate what they've done. We cannot be doing that here. We need to come up with answers and with solutions that recognizes the limitations we have, while at the same time offer our people the opportunity to exist. The second issue around sustainability for me is that whatever we do, whatever solutions we come up with, cannot be a seasonal solution. We cannot put money to an approach that we know cannot be replicated on a sustainable basis. And for me, the solution to creating sustainability is to find market-led solution rather than charity. While we have no problem with charity, we believe that the objective of charity is to create an environment where the market can begin to function and therefore would have a long-term solution. The third point on the demand side, it's that we need to produce the services for the consumer of today. There is a long-standing conversation as to where is the middle class or where is the emerging middle class. The reality is that the people we need to cater for today are not the middle class in the sense that we want, but they are today's consumers. And so how do we create solutions that is affordable for these people? There have been some effort at this, especially in education and health, and we have supported some of those efforts. To achieve that, we can leverage on technology. We can also try to help the producers to scale up so that the unit cost of production comes down. And we can also provide captive infrastructure, where infrastructures are the challenges that is faced, to be able to get to the price point where people can actually afford. The second observation is on the supply side and what we need to do. It is clear to me that there are policy issues that need to be resolved. But I also believe that a lot of the positive policies have already been put in place. The problem comes with implementation and the fact that rather than the policy becoming a way to ginger private sector participation, it is still a reason why we keep away from providing or supporting these sectors. The third item for me is how we de-risk the starting point. We need to bring in private sector capital. We need to bring in private capital, both local and foreign. But at the starting point, if this is to happen on the scale that we want, we need to put our effort into reducing the risk of failure of the businesses that will provide these services. Obviously, I have made reference to capital, but the single most important issue on the supply side is sadly human resources. So we have a vicious circle where we need to invest in human resources to be able to invest in the human resources. So if we don't break that circle where the teachers and the people who train our children are not properly trained, then we do have a crisis. So if you were to ask me, if the government was to do just one thing in the space of education, train teachers and forget everything else. Finally, I'll tell a story because it's one thing to continue to encourage private sector participation, but until they can see success stories and how such participation can not just contribute to social impact, but also to the bottom line, it's unlikely that they will do so. Sterling Bank, over the last couple of years, decided that it was going to focus its resources on 5 sectors. These 5 sectors we have coined or termed the heart of sterling. The number one there is health. The second one is education. The third one is agriculture. The fourth one is renewable energy. And the last one is transport. And the reason I'm telling this story is that we were careful to make sure that the sectors were correlated and that they support each other. So it is not uncommon for us to pay a visit to a school, looking for a way to support them, only to find out that the solution they need is a renewable energy power supply for their boarding houses. So you must again find the point where the sectors you focus on support each other. And so why did we pick on this sector, knowing how difficult it is to succeed in them? We realized that if you can find the intersection between the work that the government is doing, the work that the development agencies are doing, and the point where the private sector can participate. If you can find that intersection, that point where their interests are fully aligned, it is fairly easy to de-risk the sector and to begin to bring in private sector participation. As we speak, we have committed over 25% of our loan book to these 5 sectors, of which over half of it has been deployed effectively. We have worked with farmers across the country. We're working with schools across the country. We're working in the health sector where we, from supporting public-private participation in some of the major hospitals, to some primary health care center, and to health insurance where we're supporting some states. So in conclusion, let us first and foremost recognize that the government does not have the resources to solve the problem, but the government has the power to create the environment where the resources for the problem will be made available. Thank you.
Thank you very much indeed, Mr. Abubakar Suleiman, who's the CEO of Sterling Bank PLC. Very interesting points you made there, and I think perhaps what I found most interesting about what you were saying was that Nigeria, in its quest to improve education, simply can't become like the United States or somewhere else, because they simply can't, practically speaking, afford it. And therefore, it is very important, and that is why forums like this are hugely important, to try and find locally driven practical solutions that can perhaps improve the standard of education without having to spend as much money as people do in the West, because Nigeria simply can't afford it. We've heard all the speakers, they've all spoken now, set out their stall. At some point, we're going to go over to the audience, get your contribution, obviously very crucial. These are very important, if I might say so, crunch discussions, because Nigeria is, in fact, at a critical junction. I think if anybody denies that, then they're not really living in reality here. I mean, poverty is deepening, the economy is tremendously sluggish, healthcare and education are suffering, and something desperate needs to be done. And that's why we talk about, emphatically, about finding locally driven solutions. And when I hear people like Mrs. Toyin Saraki, and of course, Dr. Paula Bessinger talking about the things that they've been doing in Nigeria, I think the potential for inspiration is tremendous. So what I want to do is to get a bit more into that and get a better sense of how you think, Mrs. Saraki, that perhaps modeling on the things that you're already doing in Nigeria, things like maternal care and that sort of thing, how can that be widened to a point where it begins to make a much more significant difference? Because there's so many of these people who are in very dire straits in Nigeria, and what you're doing, commendable as it is a drop in the ocean. I think there's a button you've got to push under there, yeah.
Just tap it.
Activate it there, yeah. No, there's no button. No, they will do it from there. I'm sure they're working on it.
It's wired. Maybe you can turn around this way. Turn around this way.
This one is working.
This one is working? Hi, can everybody hear me now? I hope this isn't a sort of a microcosm of the Nigerian challenge. But first of all, thank you very much for putting that question to me. And I have to start with all due respect. It makes my blood boil when I hear a comparison like the United States high school student costs $11,000, and because we feel we can't afford it in Nigeria, we should give up already. If we take that attitude, we are never going to take our rightful place on the global stage. Now, what I would say as a Nigerian who has a very global perspective is that I have been looking for something for a very long time, and I don't know if the economists in this room can help me out with it. I've been looking for something called the VSL of Nigeria. That is the value of a statistical life of a Nigerian. And that VSL is normally calculated not by what you do for yourself or what the private sector does for you, because it's a baseline. It's not something you aim towards. It's something you shouldn't fall beneath. And so it's normally what your government does for you. And I calculate that from a human perspective. If a woman is pregnant and she can deliver in a health facility, I know that delivery in a health facility in Nigeria of a normal pregnancy without needing a cesarean is 40,000 naira. So can we start with 40,000? And I don't know if you can keep a tally. Then I know that immunization from age 0 to age 5, if a child receives every immunization, is around 70,000 naira. And these are the key investments that we need to do to put ourselves in the right position first to survive before we can look at additional added value investments. So that's 70,000. Then I know that for a child to go to school, even if that child is going to a free school, I know that child needs to buy a uniform, 3 exercise books, and 3 HB pencils. That is normally 4,000 naira. Then this is in a free school. So assuming the child has been born in a health facility, the child has been immunized, and the child has been enrolled in a school, we are still under 100,000 naira. And this is a country that prides itself. You know, we have oil, we have natural resources. In fact, take our human beings as part of our natural resources. We have human capital that can be invested in. And I think as the most populous Black nation, I believe, if not even the most populous African nation, for us to be giving up and saying $11,000 is too expensive to invest in our youth, who we want to take the global stage and produce back for us. $11,000 is nothing. This room is filled with businessmen, and you all know that $11,000 as a lifetime investment in one Nigerian youth is less than the salary of a secretary in a middle-ranking organization. So what I am looking for from government is to tell us how much is invested in every Nigerian citizen, and then the private sector and the civil society can decide what added value investment we want to add, actually through our organizations, to the life of every Nigerian. I would also disabuse the fact, because I hear it all the time from the private sector, and I hope Polan will agree with me here, where they say, oh, such and such is a charity. Let me tell you, the modern day charity in 2018, we're not giving because we see a photograph with flies over a wretched child. It's actually an investment. And we reap that dividend in lives saved, in lives improved, and guess what? When we are improving lives, we are saving money for government, because everything in Nigeria at a public level happens for 3 reasons. It's either we're doing something week, or something day, or something as an emergency measure, like when we suddenly look for polio vaccine as an emergency measure. But those of us in the invested civil society, which I think is a better way to describe it, we are trying to make the right conditions routine. And it is at that point of making things routine, it's actually cheaper to do things routine than to do things at the last minute. And that is what we are adding to the demographic dividend. And we need the private sector to join us in improving conditions for every Nigerian as routine. If you were to ask me in the banking sector, what is my wish list from you? I would say, give me a 10 naira opening balance to be able to open a bank account. Because we have, 79 million mobile phones in Nigeria? And only, I think, 27.9 bank accounts, and there's 198 million of us. So if you were to say, yes, Mrs. Saraki, for your 7.2 million pregnant women in Nigeria per year, let them bring their 10 naira. And I will open a bank account for them. And I will not give you all that long story about retiring their accounts overnight. And that's why you don't want, 7.2 million people who don't have more than 15,000 naira in their account. I guarantee you that they would save. And not only would they save, they would be in a better position to exercise autonomy over their own lives and be less of a burden either on government or actually the extended family network, which is actually Nigeria's first social investment program. I don't know what more to add to that.
Would you like to respond to
Thank you very much for that request. Your wish has been granted. We actually do have accounts that are open without any balance at all. But the problem, if I may take that specific issue, is that the banks today are not available in all the communities. So the investment we're making is in an agent network where Sterling Bank currently has over 10,000 agents that are in those rural communities. They are able to open accounts for people in the rural communities, and they can transact, make a deposit or receive money in those communities. So that wish, I assure you, has been granted. But the second comment for me was you asked some relevant questions as to how much the government is investing in every child. The reality is that we're struggling in many cases with about $150 to $200 in total investment, where we're lucky. I think what we're trying to ask ourselves is that pending when that money becomes $1,000 per child or $5,000 per child, how do we use that? Because we are blessed with technology that wasn't available when the education system we have today was set in place. I will share an example. We have realized that when we hire graduates from universities, a lot of them are not equipped to do the basic work of banking. In 12 weeks of intensive training, we're able to convert them and they're able to do this job. The question for me is that, do we need a 4-year university degree to train people for a lot of the jobs that are available today? Or do we need to essentially take our resources and say, we're not looking for university graduates right now, we're looking for competent people to do the works that are available today. Those are the kind of innovative process. We need to challenge the idea that there's only one model, because that model will not work for Africa in its current form.
I think that those are two very, very relevant points made both by Mrs. Saraki and, of course, by Mr. Suleiman there, that you've got to build institutions, build with what you've got, and invest as much as possible in it, but at the same time, be realistic. Vocational education, for example, could perhaps be more practical in Nigeria than going to a university where you're spending 4 years and most of the, you can't afford to give qualitative education, and therefore the people are coming out without the proper skills. But let's talk about a very critical area that I think both of you brought up, which is education and investment in that sector. The Bill and Melinda Gates Foundation, of course, one of your stated aims in Nigeria is enhancing access to financial services and collaterally improving education and all the rest of it. Give us your thoughts on that.
Thank you very much. I think on the education front, Rashid will be much better positioned to respond to that. We
In a minute.
Exactly. So we do not invest directly in primary education in Nigeria. We just globally approved a global education program. Education is, we have a very strong education in the US, but in Nigeria specifically, we support the overall government of Nigeria plan to, develop a framework toward investing in human capital, which include health, education, and also, job opportunities, etc. But I think specifically in education, I think, Rashid has been working very closely with the government. I think he can give more detail on that.
Well, let's bring in Mr. Rashid Ben Masoud, then, who's the country director of the World Bank. Clearly, the World Bank deeply involved in trying to improve education standards in Nigeria, and points that have been repeatedly made is obviously the things that hold back that stated aim of yours. What can Nigeria do to spring clean the system here and get the country out of that education paralysis, as it were?
Thank you. I think let's take the facts, because the facts speak for themselves. Nigeria has the largest number of out-of-school children in the world, 13 to 15 million people. So we need to go back to that. And quite often when we talk about investment in human capital, we should really go back to the basics, because when the outcomes are so low, we have to really focus on simple stuff. And simple stuff is going to be something along the line that immunize all your children. Let's not have children that are not immunized. Let's have all the children and the pregnant mother well nourished. It can be done. These are also simple. Let's make sure that the children not only access to school, but learn something and stays in school. So, and then bring new technology solutions so that we can provide them with the quality of learning that they'll be ready. When I summarize of all of this, the cross-cutting issue to me is women empowerment. You empower women, you create a nation. So this is really at the heart of the human capital. Second thing, Nigeria is a complex country. It has a number of the federal and the states. And each states are not at the same level of development. And therefore, we need to unpack the human development outcomes by states, because there are states that are very much lagging behind. So therefore, you need to impact the human capital by states and by teams. So when we talk about health, we should even impact them in terms of access to primary health care, access to immunization and nutrition, and so on and so forth. And drill down as to what is the drivers or the root causes of these health problems. Second, the human capital is not going to be solved only by really thinking that the government funding is enough. The government funding is just not enough to reach the pace that we need to ensure that the children are well fed, well educated. So there has to be link with the domestic revenue mobilization. Even if development partners are coming to support, like the World Bank, Bill and Gates Foundations and others, we are a very small share of the investment financing. So domestic revenue mobilization is going to be a critical part. But to mobilize revenues, you need to improve the transparency, accountability, and efficiency of the spending, so that citizens can pay tax and see that their money is being used fruitfully. The other thing is that we need to make sure that the funding are linked to performance. You get money if you perform. You don't perform, you don't get money. As simple as that. So I am trying to say that we can have a complex discussion, but let's go back to basics. Immunize all the children. Ensure that they are well nourished, that they access school and they learn something. Thank you.
Thank you very much indeed. And I'm going to throw the discussion open to the audience. And I just want to recognize the sort of presence of Enelama there, who's of course the Minister of Industries and in Nigeria here. Thank you very much indeed for coming in. But I just want to say very quickly that this is a discussion that is very important, not just for the people sitting on the panel and sort of talking at the rest of the audience, but for people who are in the audience, because this is Nigeria and we're all Nigerians. So whatever contribution you want to make, would be more than happy to hear it, whether it's a comment on what you've heard so far, or a question you want to ask, or a contribution you want to make. Is there a microphone that can go round? I don't know if you can be... There was a mobile microphone here a minute. Oh yeah, great.
Good afternoon, everyone. My name is Odwaya Soya. And I just want to add and lend my voice. Mrs. Saraki, I did read that 5 things we were going to contend with: health, extreme poverty, climate change, and security. I can't remember the 5th from the World Bank. I would want a situation where, as you help these women to take delivery of their babies, you need to let them know and educate them about population control. We can't continue like this. I'm scared at the figures, but I think it presents us with a very rare opportunity. I've read so much, and that's where I agree with the CEO of Sterling Bank, we need a homegrown solution. Yes, we don't say we're lower than the high school student in the US, but at this point in time, we need something that is local to us. We need to create our context. There's something around what context are we placing the education we're discussing, the health we're discussing, and everything we're talking about. We're saying so much, but we're not describing the context. And by context, what do I mean? We can do all of this. I also work with public school children because I believe that, we need to take care of them. Our children can go to the best schools in the world. They just may never come home. Those are the children that will rule this nation in a few years. And what I mean by context is that we need to create our own curriculum. We need to take learnings from across the world, set our context and say this is where we want to be. I can give health, I can give everything. And then our fabric of values or our values, we don't have values. We need to start from there and bring it back, like a reset for the young children growing up. And then I think if we do all of this, we can now say we're ready, for the world. Thank you so much.
This one.
Thank you very much.
Just quickly let her respond to this.
Okay, thank you very much for your statement. I fully agree with you that local content is absolutely key to actually operate a solution in local context. And if I can share with you actually why I started the Wellbeing Foundation's Mamuh Care program. I'm the Global Goodwill Ambassador for the International Confederation of Midwives, which actually represents over 600,000 midwifery associations in 136 countries. And I felt that while I'm here in Nigeria and I know all the global policy and I could wax lyrical forever on, why you need a midwife. But I really felt that I needed to put midwives at the heart of my own organization and see what they could do. And I engaged initially just 4 midwives, just to share with you the importance of local context. And they started going out to hospitals in the different states where I deployed them. They go to about 4 hospitals a day, and they give classes to women. And I think there's about 130 women in each class. And the first thing we noticed, actually, was that the hospital's management started complaining that antenatal is only full when the Mamuh Care midwives are coming. And then we noticed cross-cutting, like for instance, the HIV program people would start coming on the day that the Mamuh Care midwives were coming. And then we noticed that the husbands started bringing their wives to lessons. But the most glaring thing was the fact that where we were running Mamuh Care classes, the women were simply not dying in childbirth. And I would love to be able to put this all down to the Mamuh Care midwife, but that's actually not the reason. The reason is because the women we were teaching became 50% equal partners in their own outcome, just from that transfer of knowledge. Now, it took about 6 months for us to begin to notice this beneficial impact. So we were not surprised when the WHO brought out its new guidelines for low and middle income countries, saying that a woman should have 8 antenatal visits during her pregnancy, as opposed to the previous 4 of the focused antenatal care. So what I would say to every Nigerian who's interested in development, don't assume because you see a champion or an advocate speaking in a globally acceptable or globally translatable language, don't assume that the knowledge is coming only from, I would say, the north down south. A lot of the time, things like kangaroo care, which we're using instead of incubators, and which is proving to be very, very good in the care of preterm babies, they started here in Nigeria. In fact, my foundation was founded on writing the personal health record for Nigeria, which started as an immunization card, went into a growth card, and then went backwards to the mother. It's the first integrated one in the world that actually starts with the mother and finishes with the child at 5. But very few people know that in 1957, there was Professor David Morley in some village in Ogun State who actually created the world's first child scorecard, What we need now is to take our homegrown solutions, and just because they're homegrown doesn't mean they have to be small. We can take them to scale, and we can share this knowledge with the rest of the world. And for instance, that's where I found the Gates Foundation to be incredibly great partners, because they invest and take that risk where others might not. Another example, for instance, is family planning. I think it was in May 2012 that I led the development community to press for a single-use injectable contraceptive. At that time, it was called the Uniject. And we did a presentation to the National Council of Health. We really had to push hard for it, but it was actually allowed to be administered by community health extension workers. Now, maybe in the development community, we have a little bit of ourselves to blame, because usually when we get something into policy, we go off and celebrate, and that's where it ends. And I was shocked to discover this thing that I knew is Uniject moving through the Sahel nations with a different name. It's now called Sayana Press. And I was like, oh, but I did all the advocacy for this in Nigeria, and why is it not in Nigeria? So sometimes we actually have to look at ourselves critically, go back and reflect. But Sayana Press now, any adult woman could walk into a chemist and buy it and actually inject herself with an injectable contraceptive device, which I think just first of all, it's a very safe injection because it's a very small injection. You just push it once and you can't use it again, so it makes it safe. And then it expires in her body, it disintegrates in I think about 3 months or 6 months. But these are the type of things we need to invest in. I think $7 per dose, but I think the development community is trying to make investments in it to bring the cost down. But the truth of the matter, if you go to the villages in Nigeria, no woman will tell you that she's having 7 children because she feels like having 7 children. She's having 7 kids because she thinks some of them might die. That is why she's having too many children. If we can bring health to our people can make better choices. They can space their pregnancies, they can invest in the surviving children, and they can actually do a lot better for themselves and their families. Thank you.
Thank you very much indeed. And of course, time marches inexorably forward, so we've got to move on. I think there are a couple of questions. Let's take from the gentleman over there.
Can I?
Oh, somebody's got the microphone. Okay, go ahead.
Good evening. My name is Joaquin Varghese. I am from the private sector. I also represent the Lagos Chamber of Commerce and Industry. My question is to the Director, Bill Clinton, the country director. Few years back, you distributed anti-malarial drugs to Nigeria to be sold at a particular price. What I felt was, you are not addressing the fundamentals of malaria. Malaria is caused by mosquito, and we are not doing anything to control mosquitoes, rather we are trying to control after the infection malaria problem. So in this process, we are not achieving a long-term goal in this process. My suggestion is, whatever funds we have, a portion should be allocated to control mosquitoes which is breeding in the open areas in Nigeria. And if you have drugs to distribute, unfortunately in the past what happened is the price at which you wanted to distribute did not achieve. By the time it reached the consumer, the price doubled or tripled because of various layers involved in the distribution. My suggestion is, you should print the price at which you want to go in Naira, so that the consumer, if he buys, the trader demands more price than the consumer, he can be objected by the consumer. This is my suggestion. Thank you very much.
Thank you very much. I think this is a suggestion. I think probably the government of Nigeria, Federal Ministry of Health, the National Malaria Program is in the room. They will probably take that suggestion forward. And I think malaria is one of the deadliest diseases in the world. In Nigeria, when you look at the burden of disease, 25% of the burden is from malaria. And the bulk of, malaria, this is one of the things that the private sector is doing really great. If you look at like 100 people who have malaria in Nigeria, only 30% of them will go to a public sector. 70% will go to different private, clinics, including the PPMVs. So it's really instrumental that the government continue to double down on the strategies to fight malaria. Because, I myself, 2 weeks ago, I was down on malaria. I felt what it means. It takes you 1 week down, even though you have to take the, drug for 3 days. It's just, when we talk about, yesterday we were talking about economic opportunities and those people in the bottom of the pyramid who are really doing their best to sell something to feed their kids when they are down and they don't feed their family. The economic impact of malaria, it's just huge. So totally agree with you. This is something really instrumental. And as the Bill and Melinda Gates Foundation, we are the biggest private philanthropy contributor to the Global Fund. So we strongly support the Global Fund. The Global Fund is one of the biggest funders, along with the US government, in controlling malaria in Nigeria. So a top priority.
Okay, can I thank you very much indeed for that contribution. I just want to say very quickly that we've got very, very little time left, and I would implore you to keep your questions short so that we get on with it. Thank you.
Thank you very much. In the spirit of looking for solutions and listening to this very eminent panel, brings to mind what the gentleman contributor said in the morning about the role of religious bodies like churches and mosques, because Nigeria is a very religious country. I know that particularly the churches have been playing historically great roles. I started school from a mission, St. Stephen's in Mina. And of course, there were clinics and hospitals built by churches. I wish the other side, if we were used similar, we more or less relied on government. But what I'm saying going forward, you talked about the issue of family planning. The churches and the mosques can engage in education. Secondly, some of the civil the work that Mrs. Sadaki is doing, the work that etc. How do we engage these strategic religious bodies, particularly in Nigeria, churches and so on, involved in the issue of health and the issue of education?
Right.
In such a way that at least we can have more hands on deck.
Right. Okay. I think it's fair to say that many of those churches and mosques are already doing that work. But if somebody would like to comment briefly on that before we move on.
Yeah, very briefly, I think, Her Excellency also can comment on that. I think this is a critical point, especially when you look at the data in the northern of Nigeria. The bulk of the success that the Gates Foundation, the government, and all the partners have really got in terms of polio eradication, increasing routine immunization, and also, even in nutrition, is really the huge involvement of traditional and religious leaders. So there is now a Northern Traditional Leader Committee on Health, which exists, managed by the National Primary Health Development Agency. They meet quarterly, they discuss all the issues, they are really in the forefront, and even the recent nutrition National Council was held in the, Kano by the Emir of Kano Palace. So the Vice President asked him to host that meeting. All partners, UNICEF, WHO, the Gates Foundation, we all went to Kano to sit in the palace to discuss about that. I think they are just, they have huge access to, the population that no one else has. So they are really working on that.
I think we're probably going to take one more question from the lady.
Yeah. Right here.
Yeah.
Hello, my name is Liberties, and I have a quick question and a comment. The World Bank, she just spoke very well to the fact that we need to have very simple, practical, deliverable solutions. We're hearing about things being done all over the country, also hearing about the necessity to contextualize and to take things to scale. Is it possible, as I know that there are people manually writing to our report here today, is it possible for us to capture some of what is done in bite-sized pieces? As you said, Nigeria is a complex, multi-layered country. Perhaps the good work that has been done by Joy's team and Inquire State can be replicated and documented is one of the things you said. Because we're so busy doing the work, we don't have time to document, we don't have time to take a unit and to make it replicable in the parts of the country and to own it. So that it's not a Nigeria can't story, but a Nigeria can story. Is it possible that we break down the sort of 36+1 states and begin to look at the excellent examples? You just talk about something that's happening in Kaduna. So can we take that and take it to the new government entities, for instance, and say, you have all these people who are unemployed, who desperately need skills, can we take it and replicate it there? Can we do what Lagos State is doing with their model trust fund for young people and sort of document that and replicate it in other parts of the country? Because I think one of the problems is that Nigeria is so large and so complex and so difficult to deal with, that if we take it in little pieces, perhaps we can then look at that scalability, because it's just about replicating what's already been done. If there are any models that would be great to hear.
Hello. Yes, Dr. Lakija, you're absolutely right. I think documenting stories, success stories are so critical. The unfortunate thing is when there is a good news, you don't hear about it. We hear only about news. So I think it's really important to change the narrative that first it has to be a Nigeria-led solution, that there has to be a national dialogue around human capital, and to ensure that there is country-led solutions. And those solutions will come from success stories that are actually happening. And I can assure you that there are many success stories, just we need to document them and ensure that we can move to scalability quickly, because marginal changes will not do. We need substantial change. That means we need solutions that can go to scale relatively quickly. And here we really agree with the gentleman that partnership is very much critical. This is not going to be just a government response. It has to be involving the private sector, the civil society organization, the communities, leaders, and so on, to ensure that there is not only an improvement in the service delivery, but also increase the social accountability for the delivery of services. Citizens need to know that they are going to receive some services, and they have to hold accountabilities for the services that are rendered or not rendered. And there are also topics that are requiring very much definite type of partnerships. And here, the imam, the church leaders, the tribal leaders, and so on, are going to be critical part of finding that solution that is really contextualized. So I certainly national dialogue, partnership, success stories, so for country-led solutions.
Thank you very much indeed. We're virtually out of time, so I'm literally going to take one more question, and we're going to have to conclude.
Thank you very much. Mine is not a question, it's more of a suggestion. I'm directing this at the CEO of Stellenbosch when he was talking about education. We've never really looked at a group of people that we can harness the training and the skill set to put it to, what's the word, fill the gap left by the lack of teachers, qualified teachers. And I'm talking about retired people. A conversation came up with my classmates, many of them are retiring, and they were talking about what to do next. There's an army of trained retired people between the ages of 55 and 65 who practically have very little to do, looking for what to do. And all of us, we remember our grandmothers, those days we used to go stay with grandma and all, and that's how we were actually trained in different things. But no one is looking at that. To fill that gap with primary school education and early secondary school education. And all it will require just a retraining like we did for the people that came out of university. So I'm sure there's about 1 million people you could put into the system. Can we look at that? Thank you.
Thank you very much. That is clearly a brilliant suggestion. There are two organizations that we're working with that I will take this to. One of them is Teach for Nigeria, and the other one is 1 million teachers. I think, 1 million teachers. The people that we've already started working with. Some of them, the work they do has been so impressive that we've seen returnees come back into the country to work with them. And we've also seen people resign their work in the private sector to go into teaching. So once that's just a brilliant idea. That's all I can say. Thank you.
Okay, thank you very much indeed. And we're virtually out of time. I want to thank everybody who's been here, the panelists, of course, starting from the very top, who's sitting over there, and that is, of course, Mr. Rashid Ben Masoud, who's the country director for the World Bank, Dr. Paula Basinga, who's the country director for the Bill and Melinda Gates Foundation, Mrs. Toyin Bukola Saraki, who's, of course, the wife of the President of the Senate of Nigeria, and in her own right, the President and founder of the Wellbeing Foundation Africa, and of course the Mr. Abubakar Suleiman, who's the CEO of Sterling Bank PLC. Thank you very much indeed, and also thank you exceedingly to the audience. It is all very well, of course, to assemble experts such as yourselves to tackle the nettlesome issues of moving from poverty to prosperity, trying to get Nigerian institutions to work in this regard, but can a meeting such as this ever be more than just a talking shop? That is the challenge for the NESG. Can this summit really come up with workable solutions to this country's stagnant development? Thank you very much indeed.